Hyperbaric medicine has long been used to treat scuba diving injuries that happen when a diver comes up to the surface too quickly. But it's also an effective treatment for several other medical conditions. Here to enlighten us today is Dr. Lance Davis. He is the medical director of the Hyperbaric Oxygen Therapy Program at Roper St. Francis. Thank you for joining us, and let's get right into it. What exactly is hyperbaric oxygen therapy?
Well, the word hyperbaric simply means high pressure. So high pressure oxygen therapy is what this is. It's oxygen, hospital-grade oxygen, delivered under high pressure in a chamber. It's a long acrylic tube that's fairly spacious, but usually one person at a time goes into the chamber. We pressurize that to a pressure roughly equal to what a scuba diver might experience if they went between 33 and 50 or 60 feet of seawater. So that's a relatively shallow dive for a scuba diver, and all the patient experiences is a little bit of pressure in the ears, which they can clear the same way if you're going up in an airplane or underwater in a mountain, you just hold your nose and blow.
Yeah, we all know that feeling.
Yeah, most people have experienced that, so it's a relatively benign process. But what happens is there's two therapeutic effects that come from high pressure oxygen therapy. The first is the pressure. So if you've got a problem, say, related to a gas bubble in your bloodstream or in your body that's inappropriate, for example, the condition of arterial gas embolism or decompression sickness, which is the fizzing of nitrogen when you're scuba diving and things go wrong, we actually just crush those bubbles back into tissue, and they don't cause an obstruction or a problem in the body. The other therapeutic effect of the treatment is the oxygenation, is the additional oxygenation or the hyperoxygenation that occurs when we put you under pressure with pure oxygen. And then the oxygen itself can be therapeutic. It's actually, oxygen is a drug. In pharmacology, we consider it our first drug, and so it's just really a drug delivery system in that effect. And high pressure oxygen can serve to correct some various types of problems in the body, either due to poor circulation or infection.
Well, and we have some graphics that highlight a list of the most common medical conditions treated with hyperbaric oxygen therapy. But let's go through that list. Carbon monoxide poisoning. We also, right here on the graphic, decompression sickness, which you mentioned, and then the arterial gas embolism. But we've got another graphic. Let's talk about the other issues on here.
Diabetic foot wounds. Oftentimes people with diabetes, long-standing diabetes, will suffer destruction of the capillary beds, the microvascular circulation, those last microscopic blood vessels that bring blood and oxygen to the tissues.
Is that an example of that?
Yes, that's a diabetic foot wound. A patient we had that had long-standing diabetes suffered from a wound that would not heal because the circulation and the oxygen delivery to that wound was poor. So over a series of treatments, the hyperbaric oxygen chamber caused new capillaries, new microscopic blood vessels to form, which allows oxygen and healing factors to come into the area, fight infection, clean up the wound, and so the wound starts to normalize and heal. Now, some wounds, even diabetic wounds, can heal without us, but severe wounds often do require the hyperbaric chamber to take them over the edge and result in healing. We also see, in lay person's term, the flesh-eating diseases, in medical terms, the necrotizing infections. These are certain types of bacteria that don't respond very well to antibiotics. So in addition to cutting out the tissue that's infected and giving antibiotics, the hyperbaric oxygen chamber is indicated to help with certain types of those infections. Gas gangrene, you've heard about that, people when you think of war stories and such, but certain types of infections have a bacteria that actually produces a gas in the tissues, and the chamber helps to both neutralize the problems caused by that gas, and also they're actually bactericidal to those types of organisms. In other words, it helps to kill those in addition to the antibiotics.
Well, and real quickly, the last one on the list, before we show, we do have some photos to show folks of an example of radiation tissue damage. But we just want to give you a word of caution that if, you're a bit sensitive to images, then you might not want to see these. But it really is an amazing process to see the recovery.
Right. Radiation tissue damage, and this is an example of a patient who had multiple skin cancers on the scalp, and in order to survive, had to receive necessary radiation treatment, but it left the skin on the scalp very vulnerable, and when the plastic surgeon had to then pull that skin together after removing some of the cancers over the irradiated field, it was very sluggish to heal and was at risk for falling apart, literally. So over a series of treatments then, you can see these flaps are coming together, and that central area of radiation damage is actually shrinking. Again, radiation damage destroys microvascular circulation or capillary circulation, just like diabetes can do. And there you see a very nice outcome for this patient, whose surgeon was actually very concerned that he would never be able to get this to close.
Well, how long was that process for that particular injury?
Yeah, we are not a microwave oven. We are a crock pot. In other words, it takes us a long time to heal wounds that have been a long time in the making. And
so he had to have multiple
He had to have
treatments.
a series of treatments, and that's what we talk about up front with the patients. It took him a while to develop cancer. It took him a while to go through radiation therapy. It took him a while to develop the tissue destruction that comes in a small section of radiated patients. And it took us weeks to get him daily treatments to get him out of trouble and get that turned around. So it's a significant commitment for the patient.
But the actual process that gentleman went through to get his radiation wound treated wasn't painful as far as the hyperbaric oxygen therapy part.
Oh, no, no, no. The worst part was behind him before he got to us. And once the patient gets comfortable in the process, really, they just have to deal with the rigmarole of getting to the chamber, and they can even watch videos through the chamber. They can listen to books on CD, and it's a very benign process. Most of our patients, we see them so frequently, they kind of feel like family, and we kid with them, and we get along fine, and it's not a daunting process for the vast majority.
It's actually, it seems like a nice relaxing process for the patient.
Yeah, I tell them to take a nap, or to stay up late the night before so that they are prone to take a nap in the chamber and pass the time.
I think that's great advice.
Yeah.
Well, we have to take a quick break, but coming up, we're going to talk more with Dr. Davis about the amazing benefits of hyperbaric oxygen therapy. Stay with us.